here we are, and I have a special treat for you to start the show.
Ooh.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And you know, the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the green nurses, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.
All right. And there we have it. Welcome, welcome, everyone. Welcome to the Green Nurse Podcast. We are here truly to decrease stigma and the dialogue around what it means to feel good and be high. And we often talk about things that people don't want to talk about. However, they are very, very important subjects that need to be discussed to decrease stigma for healing and to help patients. So one of the things I said in that video is that, we teach on the endocannabinoid system, the safe utilization of cannabinoids, and other progressive tools for health and wellness and quality of life. So, we all don't wake up one day and decide to enter into the cannabis space. And there's usually a compelling story that goes along with the plunge. But today we have Dr. Michele Ross on again, who's going to be discussing with us Kratom therapy in addition to our favorite plant. But first, I want to introduce Michele. She's been on our podcast before. She's a wealth of knowledge. She is a neuroscientist with fibromyalgia who helps women heal chronic pain with cannabis, mushrooms, and other botanicals. She's authored 5 books, including Kratom Is Medicine, Vitamin Weed, CBD Oil for Health. As the creator of numerous online courses, including the first certification on cannabis and motherhood, she has educated thousands of patients, clinicians, and cannabis industry professionals around the world on plant medicine. Dr. Michele Ross is the founder of AURA Therapeutics, the first Kratom brand for women, and the CEO of Infused Partners. She served on the medical advisory board of many companies in the cannabis and wellness space and holds a PhD in neuroscience as well as an executive MBA. Whew, you're badass. Dr. Ross is known for breaking the boundaries as the first scientist to star on a reality television series in the world, finishing 4th place on the hit CBS series Big Brother 11. She's been featured on the Today Show, The Doctors, Vice, and many other media outlets, and now lives in Las Vegas. And we are so grateful to have her on the podcast here again. Welcome, Dr. Ross. I've been a fan and I've been following you for years. And I'm really, really excited to have you on with another substance that does support our bodies and is for healing. And so we're gonna start talking about Kratom. And I know nothing about it. So, so welcome to the show.
Well, thank you so much for having me. I know that there's so many other healing plants there, and Kratom is so funny. It's so highly stigmatized. I joke about it because it's really like how maybe even CBD was 10 years ago, where people go, oh, that's pot. That I wouldn't take that. Nope, that's weed. That's illegal or something, and now we know so much more about it. So I really call Kratom is sort of like the CBD of opioids. And it's a really good way to start off with if you have like no knowledge of it whatsoever. So we'll get into it. you know, what it is, what it looks like, how it works, what it does, what it doesn't do, what it could do if all the scientists actually knew about it and were researching it like we actually should be. But I just wanted to show off my little shirt because it's a little cut off here. We got a Kratom Is Medicine shirt. So I do sell these at my website on healwithaura.com. That's where we sell our Kratom when our merchant processing is working, but you can buy the shirts with square and like normal merchant processors. All
right, let's see the shirt one more time. I have to get it.
Okay, wait. Like
there we go.
It's like cut off. But I always like to spread the message. I found that to be very effective back in the day with cannabis, when cannabis was still legal in so many states, and I was working to help legalize different states. I would, you know, be wearing, you know, marijuana is not a drug, or like those different types of big slogan shirts, you know, when I talk to people, and it was really helpful in breaking the stigma. People would come up and ask me things about cannabis. And so in the same way with these Kratom shirts, people go, I don't know what it is. Kratom, you know, like whatever it is, they cracker, like I've heard all sorts of things. I'm like, no, it just read it out.
Right.
But sparking that conversation about something that is potentially life-saving for so many patients is so important. So,
all right. So this is great. So let's get into it. So what is Kratom and how does it work? I mean, really quickly, I was up in Maine doing a cannification with Green Nurse Denise, and we did a retreat, and we took the guests on a little journey, a little, you know, vacation outside of the retreat area. And we went shopping at a dispensary in Maine. And the dispensary was actually a big giant bus that was covered in Grateful Dead bears. It was really, really cute. It was really fun. And then next to it, they had a little shop, a pipe shop. So we went into the pipe shop, and all of a sudden there's this big pile of these little packets, and it was Kratom samples. And there was 10 in each pack. One was for day and one was for night. And basically it said to take 6 to 10 capsules a day. And there was 10 capsules in there. So I was like I took it, because I knew we were going to have the show and I wanted to talk about it. So what is Kratom? Like, what is it? Where does it come from? What does it do?
So Kratom, believe it or not, is actually a cousin of coffee. So it's in the coffee family. So when people are sort of shocked, they're like, what? It's like coffee? I was like, well, it doesn't look or smell like coffee or taste like coffee in any way, shape, or form. It's actually a lot more like matcha green tea. So if you've ever seen the green tea powder, right, that you might mix in and make tea with, right, it's a little bit more bitter than a normal green tea, like tea bag. You know, it's you can make it into a latte and things like that. Matcha green powder is bitter. Kratom is even more bitter than that. So like that's what it looks like. It's greenish brown, and it might be a little bit bright green depending on what type of variety it is or where it was grown. But really, it's just crushed up leaves. Now, traditionally, people would actually use the leaves of this plant, and it's only grown in tropical places. You could grow a Kratom tree in the US, but it's like harder. It would be more likely to grow in like Miami or something than most parts of the US. I haven't tried growing one out here, but like most people don't grow the trees out here, just like you don't grow like tropical teas and stuff, you know, like in your backyard. You could, but it might not be so easy, right? Yeah. It's not like cannabis. You can't grow your little tree like in your living room or something like that. But, you know, it is grown in tropical environments. So Thailand, Philippines, like Bali, things like that. So most of the Kratom is imported into the US when the DEA stops is trying to seize the imports of this. So it's sort of crazy. So think about matcha green tea. You don't have anyone trying to like steal shipments of it into the United States. And part of this is because matcha tea is considered a food. So we don't ban foods, right? We're allowed for foods to be imported as long as they're safe, you know, and they pass, you know, certain regulations and things like that. Kratom is in this really weird gray space. It's actually in the same sort of space as CBD and cannabis because it's not legal as a supplement. It's never been added as a dietary supplement, and it's never really been officially like basically approved or like classified as food. So it's in this limbo where it's not for human consumption, but millions of Americans are consuming it. So sometimes
category, it hasn't been approved for any type of category. There's not. Okay.
But that's not because people haven't tried. So people have actually tried with the government, just like with CBD, where they try to say, okay, well, you're saying we're not allowed to sell CBD because it's not a dietary well, let's go through the approval process to get CBD approved. And then the FDA keeps saying, nope, 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 not approved, not approved. There's nothing you can do that will make us approve this. And so Kratom has actually had the same thing where people have applied to make it a new dietary ingredient and they just reject it. Oh, we need more research. We need more research. And they just make up things. But the thing is that Kratom has been researched very recently, tons of studies. So about, is it healthy? Is it safe? Does it cause like reproductive harm? Like all the same things that CBD and cannabis went through. But, right now we're just talking about what it looks like, what the legal status is and things like that. But we haven't even really talked about like what it does and why you would take this thing, especially because it tastes really gross. And that's why it's a capsule a lot of the times, because people don't like to drink the tea unless it's got like the lemon and sugar in it, or you mix it in with chocolate and things like that. If you're a chronic pain patient and you drink it all the time, you sort of get used to the taste.
Right.
I actually made a formulation called AURA tea that had like raspberry powder and cocoa powder and things like that to increase the effectiveness of the pain and the anti-pain and anti-inflammatory properties of Kratom, but also like to mask the taste for newbies. But a lot of people use the capsule. So that's where you found them, where you're like these capsules and how much are in each capsule, how many milligrams of Kratom am I taking,
No idea. No clue.
So there's a lot to learn. So we're going to go through a little 101 here.
Yeah.
But what is Kratom? So like basically what happens when you consume these magical capsules that have appeared out of nowhere? That goodness knows, by the way, hopefully because they came from a dispensary, they had some kind of testing or something. But I just want to warn people that because it's not regulated, very similar to CBD, and some states have made laws about, hey, you need to say what the active ingredient is, how much there is, make sure that there's no lead or bacteria or E. coli, like that kind of stuff in there. Some states like Nevada, which is where I am and my company is, has created those laws. So it's like illegal not to have a nutrition label on it, like a food item, and you have to have it tested and things like that. Other states, you could literally just go, oh, I got this baggie of Kratom. I put in these like little bags. It looks like drug dealing, basically.
Yes, absolutely.
It's not safe. It's a little scary. So that's not where we're talking about. We're going to talk about the regulated, safe industry where it's moving forward.
And it's exactly what we're doing here in the space is when we educate patients, we teach them to look for a certificate of analysis.
Yes.
I mean, if your gas station CBD is probably not going to have a certificate of analysis. And so you really need to be able to look at that, where it's coming from, contaminants.
Label, nutrition label.
Is that a bag of Kratom?
This is actually the bag of Kratom tea. So it's not just the Kratom. This is the one that has the raspberry and the other ingredients in there. And again, you have to have the nutrition label because
you made that.
Yeah, this is my formula.
Is that for sale?
Yes, you can get this at Heal with Aura. So if you want like a nice little raspberry chocolate, little pain relieving cup of tea, there you go.
All right, what's the website? Let's put it up.
Healwithaura.com.
Okay. Heal with AURA.com.
Yes, and Aura is like aura, like the rainbow.
Yes, the Aura. I know.
Yes, that's where you can get the t-shirts, the book, and all that kind of stuff. But
okay, so that's really cool.
Yeah,
so we see that it's there. Just so I just want to write it down for the viewers.
Yeah, you pop that right in there.
raspberry. Tea?
Yeah, it's got raspberry, cocoa powder. So it's a powder. So it's very similar to matcha, like a latte. It's like basically like a little bit of a Kratom raspberry chocolate latte mix.
Okay, raspberry cocoa chocolate latte mix.
Yep, got a bunch of different things in there. And again, besides masking the taste, everything, I'm a neuroscientist. So I'm all about formulating products that really, again, provide those really functional benefits as well. So cocoa, again, we know stimulates our endocannabinoid system and everything. Yeah. So you got a little bit of that there. So a lot of times people will take CBD and Kratom together too. There's some products on the market like that. So we'll talk about why they work so well together. Yeah. And again, why the different pathways. So when we talk about cannabis, we're talking about our endocannabinoid system. When we're talking about Kratom has nothing to do with your endocannabinoid system. It's not, to our knowledge anyways, maybe something will come out of left field, but it's not activating any endocannabinoid system, cannabinoid receptors, no CB1 or CB2. It's activating primarily the opioid system. Although we're finding out that there's other targets in there like serotonin, dopamine, acetylcholine. So I love Kratom because it's very complex. What we're learning is that it seems like a very simple, cute little plant. Oh, it's a relative of the coffee tea, but we're finding out it's as complex as cannabis. Now, cannabis has over 500 chemicals in it, hundreds of cannabinoids, terpenes, flavonoids, so many different things. And we know that there's an entourage effect where, these different compounds work better together than they do, by themselves. So for example, CBD works better with the terpenes and the other cannabinoids, et cetera, than just a single extract of one chemical, which is, what we normally see in the pharmaceutical industry. Okay, we've got one pill and it's just got one ingredient. That's it. Yep. Kratom it doesn't have hundreds and hundreds of chemicals. It's not as complex as cannabis, but there are still many, many of these alkaloids. And what is an alkaloid? So an alkaloid is a nice little pharmacology word there, but it's the active ingredient of a lot of different herbal plants. So actually psilocybin and magic mushrooms is an alkaloid. So again, cannabinoid, alkaloid, it's about its chemical structure. So here we have these alkaloids. So the main alkaloid in kratom is a mitragynine, and then we have 7-hydroxymitragynine. And then we have alkaloids that are like minor ones that, depending on what type of like cultivar of kratom you get or how it's processed, you might have different percentages of these other minor alkaloids in there. But we know now that there are different, products out there. Some will give you more energy. Some will make you more sleepy. Some will be more pain relieving. Right. So a lot of the terminology, it's sort of easy. When somebody knows about cannabis, it's really easy to explain to them what kratom is or how it works. Because you're like, oh, the white strains are more energizing. Think like a sativa. And the red one is more pain relieving and sleepy. It's more like an indica. And they're like, oh, got it. Good. It's super easy. But then there's also this like layer of complexity where it's not so simple of like, hey, this one color is an upper and the other color is a downer. You've also got a very similar thing to cannabis where it's all about dosing. So we know that microdoses of THC can be very energizing and mood lifting. And then like higher doses, could make somebody very sleepy. So in the same way, kratom, even if you took a product that was energizing, right? So you have the energizing one, it's not supposed to put you to sleep, but you took all 10 capsules because the instructions told you to take way more than you should, and you're snoozing during the day instead, So it's sort of, you have this U-shaped, dose response curve. So you have to really know what you're doing, with kratom. And know how to dose it, what products to use, whether you want to use capsules, whether you want to use a tea. You need to know things like, what dose does a beginner use? How frequently should you dose kratom? When are you, when have you reached a max for tolerance and you're actually a kratom abuser? Because, we talk about these things where healthy cannabis use and things like that, tolerance to cannabis. We know people that dab cannabis like 24/7, like that might not be healthy and things like that. You might be flooding your body with too many cannabinoids and things like that. There's some, things with kratom. So a lot of people are taking these products because they're activating the opioid system. So there are primarily two main groups of people that use kratom. So you have people that were shifting from recovery from either using legal prescription opioids, whether they're using them as a patient, abusing them, etc., or people who are using heroin. So we have people that come off of these substances and onto kratom, and they're using very, very high doses of this. That's where kratom can be dangerous because, you're using a lot of it. It's overacting, overactivating your opioid receptors can cause nausea, dizziness, heart issues. If you're drinking alcohol, it can cause you to fall asleep and things like that. So we're not talking, about kratom use in that way right now. Like, I'd like to talk about it as, hey, I'm a fibromyalgia patient. Yes. Sometimes I use CBD. Sometimes I use a THC gummy or something like that. But I have a lot of pain and I want to be awake during work. What do I do? I don't want to be on opioids. I'd like to just use CBD and something natural. Is this for me? Right. And so that was me, 5 years ago. So I was struggling as a pain patient. So I was on morphine. I was on all maybe 10 other medications after I got diagnosed with fibromyalgia. So I had a whole bunch of health problems. Back in 2014, I almost died. I had a heart attack, a lung collapse, blood clots in my legs, hundreds in my lungs. The doctors were like, "You're a Christmas miracle." I literally came in on Christmas and they gave me like a 30% chance to live. I lived because apparently I had a lot of work to do. So, you know, I ended up being on all these prescriptions, an oxygen tank, like, you know, wheelchair, all this stuff. And I was a mess. And I didn't want to be on all those things. You know, I'm a neuroscientist who studies drug addiction. I was like, how did I end up on morphine? Like, what? Like, this is my normal life. Pop pills. Like, that's it. Drool on myself. My husband was taking care of me and wheeling me around. It was a mess. And I wanted to get off the morphine, and I did with CBD, and then like maximum like edible doses of cannabis, which is crazy. You know, you can study again withdrawal from opioids and things like that, but until you go through it, you really have no idea what it's like. You're like, I'm not doing heroin, so why is this bad? You know, like, no, it's bad. Your body. Some people are very dependent, especially if you're a chronic pain patient.
Oh my God! Like even antidepressants and anti-anxiety agents, you know, you get those and coming off of those. Oh my God, the last few Xanax, holy shit, that was horrible.
Yeah. So for me, so I went through this process where, you know, I came off of the opioids. Thank God I was off of Lyrica. I was off of everything that the whole kitchen sink that they had prescribed me. But, you know, I was still in a lot of pain. I had just been, you know, not prescribed, diagnosed with fibromyalgia. I had some other issues. I was still recovering from like lung issues. So I wasn't supposed to like smoke a lot of cannabis and things like that. So I was trying to like get back to work, but still manage pain. And I was actually trying to apply for a professor position where I wasn't supposed to be using cannabis at all. So I was like, oh, I'm going to like, you know, not use cannabis for a month and a half and see how that works. You know, the short answer to that is it didn't. I was like, I need this to live. So it didn't work. I was cramped up. Like I couldn't even hold like a pencil. It was horrible. So I need cannabis to function. But I also, you know, but one of the things that I found out was, you know, asking questions, right? As a researcher, I was like, what else can I use? What else is out there? And somebody's like, let me mail you a baggie of pills. And I'm like, what are you sending me? Very much like your situation where I got this baggie of pills and it was like, no label or anything. Oh, I get this big baggie of pills. So I just gave you some and I sent them. And I was like, this seems so sketchy. I hope I don't die. Like, that's literally what I felt. And I didn't know anything about Kratom or anything like that. Like trying to research it on the internet, it was like, this is basically like legal opioids. And I was like, this doesn't seem right to me at all. Like, and I used it. It made me feel better, but like I stopped for about a year and I was like, I need more information. I don't know what's in these things. Like, this is weird. And then, you know, companies started to do a little bit more testing and things like that. I started to meet some people in the industry and I started taking it again. I found a good vendor that had testing and things like that. And I was like, okay, I feel safe. But, you know, it wasn't something like I could just walk into a health store and find it. I know that there are Kratom shops, or I would say head shops, where you can buy your glassware, your rigs, your bongs, and your Kratom. Seems like a weird place to buy that, right? But, you know, smoke shops. But the reason why you see Kratom in smoke shops isn't because it's a sketchy product. It's because it's considered a vice product by the merchant processors. And so your regular health store can't sell Kratom because then they won't be able to sell like their other stuff. So it's like the people that already got like nicotine and weird stuff approved are allowed to sell Kratom because they're already like considered high risk. So that's why you see it in some of these sketchy places. When I lived in California, you never found it anywhere except online or in a head shop. So like I just never came across it. And in Denver, actually, it was funny. Once I started taking it and I started like consulting patients about it and things like that, I was like, hey, you know, here's an option for pain in case, you know, you're really highly sensitive to THC or CBD isn't strong enough, or you want to do something. We can talk a little bit about dosing and things like that. But I was in Denver when they made it illegal. It was the first city, I think, that made it illegal. And I was like, what the heck? I moved to Denver. I learned about something that's working for my pain. It's giving me energy. It's helping me with my pain. It's boosting my mood. I'm focused. I'm clear. Like, this is like a overall winner for fibro pain. By the way, like a lot of fibromyalgia patients love it. Like, because it's different than opioids. And again, because it is hitting serotonin receptors, dopamine receptors, some other things. So it's doing something a little different. Yeah. Right. So for me, it was really helpful. And it was like Denver made it illegal.
Denver. Well, here's the thing. Here's the part that I really want to talk about, because, you know, you created the first Kratom brand for women, right? A lot of women have fibromyalgia, menopause, hormonal issues, I can think of all these different things. And that's what's going through my mind is I'm like, what conditions do women have? And what might use Kratom for? So can we go into that? Because I think it's really important. I want to promote your brand and your product. And
yeah, no worries. Well, I want to talk a little. I mean, it helps to go through that process of like how hard it is as a patient, to go through some of this stuff, and give the inspiration of like why I decided to make my brand. Right? It's like if you're getting baggies of stuff in the mail, you're not even certain. Is like it's not packaged correctly. Like if I wasn't a scientist who knew the person who was sending it to me, I wouldn't buy it. Like I wouldn't trust this at all. So like for me as a woman, especially one with an MBA, like I know marketing, I've been in nutraceutical marketing and cannabis marketing, things like that. I was like, we need a brand that's, is educating women and also is like appealing to women, right? And so like my packaging, right? It's like, okay, we got a little purple, little rainbows here, trying to make it like as nice as possible, not gas station junk. Or by the way, a lot of the brands, I've met a lot of the owners, I love them and stuff, but a lot of them are like, hi, I'm Mr. Olympia, or I'm like a used car salesman or something. Like it just doesn't fit in with like the medical part of it. And a lot of them don't, do that education because the government doesn't really like us to educate. But, again, I didn't get the doctor in front of my name to not educate people. So it's happening. But in terms of my product, the more I learned about Kratom, and especially with all the new research that's coming out of the University of Florida and other institutes, we're learning that it can really be helpful in the same way that cannabis is really helpful. So vitamin weed, I wrote it about endocannabinoid deficiency, which of course is a theory that was put out by Dr. Ethan Russo about people having endocannabinoid deficiency in disorders like fibromyalgia, migraines, irritable bowel disease, and other likely many other disorders. And that's why cannabis is very helpful for treating that root cause of the disorder.
Right.
So one of the things we never talk about, because the opioid epidemic has stigmatized opioids, and our own opioid system, our own endorphin system is stigmatized it so much right now. We never talk about endorphin deficiency. Now, endorphins are actually our natural opioids in our bodies. Right. So we have opioid receptors everywhere, and they help, with pain and inflammation and things like that. They have other signaling properties. They're also involved in mood and energy, motivation, sex, like feeding, so many different things. So very similar to the cannabinoid system. It's not as ubiquitous, so it's not in every single cell in our body, but it's in a lot of places, right? And so if you don't have high level of endorphins, you might feel run down, achy, moody, grumpy, unmotivated. So very similar again to endocannabinoid deficiency. But one thing that you can think of off the top of your head where you might be able to see endorphin deficiency is people who have abused opioids. One of the reasons why it takes so long for people who were dependent on opioids to withdraw, there's even that pause, syndrome, like after opioids, where you still feel like crap and you're still at high risk for relapsing. Why do you feel like you need opioids for so long after taking opioids? Because it takes forever for your endorphins to kick back in. So if you're using cannabis, your endocannabinoids actually go down a little bit, but as soon as you stop, it goes back up. It's really easy to replenish your endocannabinoids after a cannabis tolerance break. That's why you only need like a couple days. Yeah. If you are using opioids for a long time, it is going to take a long time for your body to, restore that. And so that's
it's what it is. So when we go without cannabis or THC, our body gets nervous and starts to create more receptors, actually looking for those internal endogenous cannabinoids that we release. And so the next time that you go to consume, there's a higher probability that you're going to feel the effect at a much lower dose. Is that right?
Yeah. Yes. And so with endorphins, it's unfortunate because it takes your body so long to do that. And so that's why, Kratom helps people, stay abstinent from the harder opioids when they're in recovery, things like that. But there's other conditions where you see it in endorphin deficiency. So fibromyalgia is one. So if you test my bloodstream right now, off of Kratom, I would have very, very low endorphins. And so that, again, that's contributing to pain and inflammation. And that's why some people with fibromyalgia, even though they're taking their CBD or their cannabis, they still have severe pain issues and they still have fatigue issues and things like that. And so it's sort of interesting is that, again, everyone's disease is a little bit different, but it seems like if you can increase the energy levels and decrease the perception of pain, you're going to improve anyone's chronic condition. So it's like, for me, that's it. I always actually responded pretty well to opioids. And it was like, it always made me feel bad as a drug addiction, neuroscientist was like, I was happy and like pain-free. And then with cannabis, I never got the same like euphoria from cannabis. Like, it's interesting. THC is sometimes dysphoric for me. So it's like I use a lot of higher doses. Like I'll use my highest dose of cannabis at night while I'm sleeping, because when I'm awake, it just makes me a little bit more aware of my pain and things like that. So I found that Kratom makes me ignore the pain completely. I'm happy. I'm functional. Like I was like, okay, well, this is my daytime substance.
That's awesome. That's funny that you say that too, because I was talking to a friend of mine, and we were talking about doing cannabis before. You have to have a tooth filled or dental work. And she's like, oh God, no, I want the real drugs. Because she said sometimes, depending upon the cannabis, she says, if I don't know what's in it or I get it as a gift or whatever, it can make me hyper focus.
Yeah. And I don't know what it is. I don't know what it is. There's a subset of users that are just like, drill down. Like, honestly, I have sciatica. And so with certain, like I would say 90% of cannabis products, all of a sudden it's just like a burning hot poker. Like I was like completely ignoring it, like going on my day with my, like, my little Jedi mind tricks. And then as soon as I took the gummy, it'd be like,
Right.
so it's interesting. So that's, again, it's like what type of imbalance is happening in your brain or in your nervous system. And as a nutritional neuroscientist, it's like fun trying to figure out for a patient. It's like, what do you need more of? Balancing your opioid system, balancing your endocannabinoid system, balancing your serotonin, your dopamine, et cetera. And so for some people, their opioid system needs a little bit more. Now, in terms of women's health, it's really interesting because we also know that, we cycle as women. So, we're not even the same on different days and weeks of the month or different periods of our life, right? We have perimenopausal, menopausal, postmenopausal women. So we're all different in different phases of our life. But we do know, similar to endocannabinoids, that at, different parts of our cycle, we have different levels of endocannabinoids. We also have different levels of endorphins. So again, when we're feeling our moodiest or crampiest or not or not our best during our cycle, for women that are cycling, you can bet that your endorphins are low, just like your endocannabinoids are low. And so I would say that for menstruating women, Kratom can be your cup of tea for sure. So you really, if you're in a lot of pain, I would rather you reach for a cup of tea or a couple of capsules of Kratom, go through your period with less pain, less inflammation, a little bit more energy than suffering. We know so many women that are on the bathroom floor crying their eyes out, like, dear God, kill me. I mean, I was one of those, right? So I used to end up in ERs and things like that. And now with Kratom, it's really nice because it's something that you can avoid the opioids. You don't have to go to your doctor for that. What I like too is with Kratom, because it is an opioid, you can develop tolerance from it. It is safer than other synthetic or poppy-based, opium-based opioids like morphine, oxycodone, like those kind of things. Why Kratom is safer is because when the alkaloids in Kratom bind to the opioid receptors, what happens is it doesn't activate the same downstream pathways that synthetic opioids or, again, the opiates do. So opiates can kill you because they activate the opioid receptors in your brainstem, and then you stop breathing. So that's how you die. That's what the opioid epidemic is all about. Is like, oh no, people slightly overdosed, or you drank alcohol and you took your opioids, you're done, right? With Kratom, as long as you're taking Kratom by itself, it's not safe to drink alcohol and Kratom. So please don't do that. Just like if there's ever been any deaths reported, that's always like the user was like, I did Xanax, alcohol, and Kratom all at the same time. Like don't mix the downers, please. But Kratom by itself is very similar to cannabis, where because it's not activating respiratory depression, because it's not activating the same sort of addiction pathways, it's much more safer. So even if you're consuming a large quantity, what would happen most likely is that you would just vomit it all up.
I was just going to say, just like cannabis.
Yeah, you might end up in the ER because you're like, oh goodness, your blood pressure went off or something. But you would have to consume a lot. And so in those cases, it's usually because somebody is reading the bag for the first time and they go, oh, it says take 10. And you know what? The capsules, it's very interesting because depending on the size of the capsules, when you work in the business, you're like, oh, there's 0 capsules, 0 capsules, 0 capsules. So there's different size capsules. There's really big ones. The really big capsules are what we use for Kratom, because Kratom is like really fluffy. It's hard to pack in capsules. So you need a really big capsule to have like 600 milligrams in it or something. So I've seen capsules anywhere from 300 to about 700 milligrams in each capsule. It's really important to read the back so you know what your dose is. For a newbie, I would never take more than 1 gram of Kratom. And so, you know, depending if you're taking,
so people know 1 gram is 1,000 milligrams.
yes, 1,000 milligrams. So
and that's
if you
in
have
24 hours or in one dose?
In one dose. And I would say your first time you're using it, just use that one dose, that one time, because it's like any other medication. You know, if you try it the first time, especially if you're like opioid naive or you haven't used opioids in a very long time, you might be like, oh, I feel nauseous or a little headache or something like that. I would say your very first time you want to not take it on an empty stomach, have a little bit of food in there, you know, try the Kratom out, see how you feel. I would say that again, like the next time you use it, you know, try it maybe twice in one day. And it's always easier to take more than you'd like to try to take less. You're like, oh my God, I made myself so sick. You know, you don't want to do it where, and a lot of people will do this, just like that first edible somebody takes, right? Everyone is always like, go low and, you know, go slow, right? And like take the 5 milligram. They're like, I took the gummy, didn't work, took more. And then they're like puking, you know, for 10 hours later, or they're asleep, right? So with Kratom, you have a similar thing where people don't really know how to dose or things like that, or they're impatient. So because it's a capsule, right, it has to go through your digestive system, and actually your digestive enzymes is very interesting. It breaks it into more psychoactive and more a pain relieving alkaloid. So you actually have enzymes like in your blood that turn the alkaloids into stronger alkaloids. So it's very similar to taking an edible where the THC gets turned into hydroxy THC, which is stronger. Right. So, you know, if you're impatient and you're like, oh, I want pain relief in 5 seconds, like that's not happening. Your body actually has to metabolize it. So it can take about 30 minutes. That's why some people actually choose the tea versus the capsules, because the tea, you get a little bit of sublingual, you're getting it a little bit faster, especially because of the heat and things like that. So that's why if you're a significant pain patient, you're using high doses and you're like, oh my God, I'm going to die if I don't get pain relief right now, like you go for the tea. But if you can wait and you're more regiment, you know, more disciplined with your pain management, you know, or you have something else you're combining it with, like, hey, I'm going to bake my CBD for immediate pain relief and then wait for the Kratom to kick in. That's the kind of stuff that I teach my patients, right? It's like, you know, don't double up on the Kratom, you know, use something safer along with this, you know, to try to keep your Kratom levels low. So I always teach people, I'm like, you know, try to alternate them on different days. Don't try to escalate your dose and things like that. So when I was talking about 1 gram, there are patients, you know, that I work with that are using up to like 5 grams, you know, 3 times a day, which is a max of 15 grams. That's like the max. Like you don't really want to be taking more than that. And that's like, I would much rather have a patient use Kratom, say in the morning, and THC at night. And the reason for this, again, is like, you know, when you don't use the same substance over and over every single day, you don't develop as much tolerance, and it's much safer.
Yeah, I completely agree. And like we always say, our cannabinoids requirements change over time as we change. You know, our bodies are constantly changing. And so that actually makes sense. So I'm curious to know too about the about the dosing in particular, and with the tea. So a lot of times I'm just gonna, because I'm comparing it to cannabis right now. That's where my mind's going. So for example, I will sip on a tea, a regular old tea that has water soluble CBD in it. Or I will sip on a coffee that has canna butter in it, and I'll sip on it all morning long. Is that something that could be done with Kratom? Or do you want to just drink it all down in one shot? Or would that be considered like microdosing Kratom?
So, yeah, it's interesting. So Kratom doesn't have a very like long half-life. So people end up dosing it like 3 times a day if they are a chronic pain patient and they're not using anything else, right? So it's like, if you are in significant pain, like you woke up and you're in your level 10 pain, which is like me, you know, when I wake up, I would just prefer to get my like first dose of pain management in the morning. And I also use it for energy too. So like for me, I'll make some Kratom with coffee and just sort of like take it all down. You don't have to do a shot. So if you've ever heard of people doing like Kratom shots and things like that, this is like such a weird culture, by the way. It's like when you're new to it, you're like, people do this? What is this? And you're like, oh, I understand now. So there's a method called toss and wash where people will like basically take a whole bunch of Kratom powder and like toss it back with like water, like a shot. And the whole purpose is like Kratom capsules cost more, like, so basically people just buy bulk Kratom and then they're like trying to toss it back with water and stuff. It's sort of gross. I don't do that. I suggest people, I'm like, please just make your tea and like don't be like weird about it.
I like it neat. I want it to be as a nurse. I want capsules. I want tea bags.
Exactly. Well, it's also harder. I think like sometimes to eyeball and things like that too. With capsules, if you're using it from like the same manufacturer all the time, you're always like, okay, I used 3 capsules. I got my 1.5 grams. Okay. Like I tell people to journal too, because that really helps, especially like if you are a chronic pain patient, you're forgetful. So you're like, oh, did I take my morning one? Nope. Okay, taking some more. You're like, oh no, too high now. Like, you know, you want to be careful about it. Journal, whether it's your Kratom, your cannabis, like your ashwagandha, whatever it is, because you can OD on your herbs. So you gotta be careful.
Right. Exactly. So how would, let's just give an example of how would a woman, you know, just give an example of a woman that has, you know, issues with her menstrual cycle. You know, how would she take it? Like, how would you recommend her to take it?
Yeah. So
or osteoporosis, menopause. How about menopause?
Yes, menopause. Okay. So you want to help control your hot flashes, or you want to, again, boost your mood, get a little bit of energy, because menopause definitely has a lot of fatigue, brain fog issues. Again, a lot of the things that are very similar to fibro. So, so if you are, again, a newbie, you want to, again, start off with like 1 gram day 1, day 2, like 1 gram times twice a day, day 3, you know, 1 gram 3 times a day if you need to control it the whole day. But again, what you want to do is never increase your dose a lot. Like go by small increments each dose until you find a dose that really manages your symptoms. Again, you don't want to be going to 5 grams to manage hot flashes. That's probably not appropriate. Those are doses that's more appropriate for severe chronic pain or something like that. So again, on the higher end is people dealing with like ovarian cyst pain or cancer pain. There's a lot of back pain patients that use Kratom, because again, it's very similar to the effectiveness of opioids. So it's like your risk versus benefit sort of analysis. Like, okay, if I'm going to be taking something that I might build a dependency on it, right? Some patients, it's okay to be dependent on your medication if that's making you functional and it's improving your life and it doesn't have side effects and things like that, right? So some patients, some patients know, right? It's like, well, if I'm going to have to choose between OxyContin and Kratom, what's a better one for me, right? The one that I can't die in my sleep. So, you know, for example, tramadol. We know that tramadol is one of, the most scariest ones, because there's people that are like, oh, I took 1 more pill than I was supposed to, and like, you know, I ended up in the hospital and OD. So, or people that have like 1 drink and they forget, they're like, oh, I was on opioids. Again, with Kratom, you could, again, have a drink. What will most likely happen is that you'll get nauseous. You'll be like, I don't really feel like drinking another one. Like, you're not going to be like, oh my God, I drank like a 6-pack and I had my Kratom and I died. Like, that's not what's going to happen. Actually, people find, similar to cannabis, that they actually want to drink less. So a lot of people during the pandemic, I've helped a lot of people with their drinking problems, actually, because they're like hitting the bottle. And we're like, okay, well, you're using alcohol for both, you know, your depressed mood and your pain. Let's shift you something healthier.
And we all know alcohol is going to make your depressed mood even more depressed. And
oh my goodness,
pain even more painful.
It's going to make your cramps worse. It's going to make everything worse. Increases your cancer risk. So one of the reasons why Kratom is really nice to bring up in the conversation is, you know, it's like we're lucky. We live in states where cannabis is legal medically, it's legal recreationally, or for the adult use market. So anyone can access it, right? In Nevada or Massachusetts, but you know, when it comes to certain states, they're in the middle of nowhere. That like CBD might be illegal, like cannabis is illegal. Kratom is like the government hasn't done anything about it, so basically they can buy it, and that's a way that they can manage their pain. It's also very popular among people that have no health insurance or are underinsured, because again, in order to see your doctor and continue to get opioid refills and things like that, it's a process, and it can be very expensive for patients. And so get this, like the price of Kratom is very cheap. It's going up now because the customs and stuff is trying to like confiscate shipments and things like that. But I mean, when you're a wholesaler, you can get like kilos. We're talking, you know, a very, very large amount for like $70. So this is something where, you know, when we're talking about taking 1 gram for your dose and you can get an entire kilo for under $100, right? You're having pain management. Somebody can buy a large quantity. And a lot of times patients do, where they buy a big package of it and they portion it out, you know, over the year, put it in their freezer, things like that. And I would tell patients too, that you can be exposed to oxygen. So like if you buy a really big package, it might become inert by the end of the year. So you got to be careful with it.
Stress, right? Making it inert, like changing.
Yeah, like oxygen changes it. Yeah, makes it less effective over time. So you got to be careful. Just like with cannabis, I mean, it's funny, is sometimes oxygen and light can change it to other things, like THC can turn into CBN. What happens is that the active ingredients kratom don't turn into anything magical. It just like turns into dust, basically. So you got like your gross matcha tea. You think it works. You're in a little placebo effect, but it's over. So you want to make sure that your stuff is fresh. So that's why people tend to buy. They're looking for a real good pain relief, you know, smaller bags so that it doesn't go bad when they continue to take it out and things like that. Yeah. But it is interesting how the price is so different. So that's another thing, right? Like, why would the government, and by the way, the US government right now is hardcore attacking kratom in the United States. We have studies out there from other addiction experts saying that, okay, you can't OD on it. It's actually being used right now in clinical trials as a treatment for heroin addiction. So it doesn't cause addiction. It's the treatment for addiction. Just like we know CBD and cannabis is treating addiction, right? So it's funny. It's like the US government sort of stopped trying to destroy the cannabis industry so hard, and they moved on to kratom now. And it's just devastating for patients, because if you're a chronic pain patient, you're sort of running out of options. A lot of doctors are like, oh, I can't give you a prescription. You're like, I've met mothers that are literally just had a cesarean and their doctor won't prescribe them opioids. You're like, you just came out of surgery. You're in like horrible pain. Like an aspirin is not going to cut it. And there's times where opioids are appropriate, right? Pain management is appropriate. And instead we have these patients that are being driven to the illegal market because they're like, well, cannabis isn't legal where I am. They won't give me opioids. What am I supposed to do? I guess I'll hit up the heroin dealer, you know? And these are horrible, horrible things. This is not what we want. And it's unfortunately, we see patients right now are being disempowered. And so that's why the education around kratom, how is it safe? How do you use this? What is the research around this? You know, at least empowering patients to learn about it, feel comfortable talking about it. The thing is that it's very similar to cannabis, where if you talk to your doctor about kratom, they're going to be like, I don't know what that is. Don't do that. I'm going to report you. Like, so right now it's very still like taboo, even though I would say the number of patients in the United States that are using it is over 10 million. And the demographics about it, it's funny because you'll see a lot of like MMA fighters or like, you know, advertising it and things like that. Like they're the spokespeople for brands and things like that. But in reality, who's using it? It's like the majority is actually women in pain. So it's like soccer moms, you know, it's just like cannabis, where it's like, oh, actually your vision of who a kratom user is, your vision of who a cannabis user is completely off.
Exactly. So what I want to talk about next is let's pull out that tea bag again.
Okay.
I'm gonna buy some.
Hello, tea.
And once I get it it comes in the mail and comes to my house, how am I going to make my tea?
Sure. So there's a couple ways or a couple tricks you might want to use for your tea. But basically what you want to make sure is that you don't microwave the kratom mixture because, again, like many different substances, sometimes they microwaving it will break the chemical bonds and make it a little less inactive. So you want to heat up your tea. I just microwave my water, and then you want it hot, but like not so boiling, one that you'll scald yourself or that you'll like melt the kratom and make it, again, like inactive. So you want it to be very hot, but not super boiling. So you're going to just boil your water. And then you can take a teaspoon of that mix, whether it's the pre-made or a tea mix that already is flavored, or you can take a teaspoon of whatever kratom you had at home or something and put that in the water. I like to put lemon in it, and it's sort of interesting because the lemon can actually break down the kratom, the plant cell walls, and it helps release the active ingredient a little bit. So have you ever heard of lemon teching with magic mushrooms?
I do. That's how I do it.
Yes. So the real experience way to do this, and it makes it actually a little bit more effective. So when we were talking about, hey, why did somebody use a capsule versus tea? You know, we talk about getting the active ingredient into you. Yeah, a little bit faster. So if you are a pain patient and you're trying to like save money and get like the most, like use little, but like feel the effects a little bit better, you can actually put the lemon juice and the kratom together first, like swirl it together. And then like 2 minutes later, then add the hot water. So it sort of is broken down. It's ready to go. And then you drink that, you could sip that, and you'll start feeling pain relief probably in about 10 minutes.
So a teaspoon is how many milligrams, just so I would know?
So it depends on ours. I'm totally geeking out. It's on our website.
Oh, okay.
But we have like 7 different products. Yeah.
All right, that's good to know. Okay, no, it's good to know.
But yeah, there's different ones. Yeah. So
what's these serving suggestions? Like a serving suggestion?
Yeah. So again, every kratom strain has a slightly different active ingredient, like amount of active ingredient, right? So again, the metrogenin and 7-hydroxymetrogenin. So it's like it varies between batches, it varies between different things. But that 1 teaspoon, I mean, you're getting a significant amount of kratom. So it's usually around like 1 gram or 700 milligrams, that one.
Okay.
So again, like that dose we were saying, it's like for some people, again, I try to formulate it where the other ingredients, like the raw cacao in there, is also a mood lifter. It's also an anti-inflammatory. So I try to put in things in there that weren't activating the opioid system, but we're still providing relief. So that way you don't have to like double or triple your dose and be like, oh, I need like 4 teaspoons of this. Trust me, if you use 4 teaspoons, you'll be sleeping. You won't be having a good time. You'll be asleep like that. So yeah. Don't start off with that. I tell people again, try to go for the lowest dose possible and then see how it works for you. A lot of times people are surprised that they can go with a lower dose of kratom when it is paired with some of the other ingredients. So,
right. And so
it's all about harm reduction.
Exactly. So here's my question too, because people are going to ask, do you feel high when you take it?
Okay, so I would say,
what is the feeling? Is it similar to cannabis, kind of different? Because I know a THC high is very different than a CBD feeling chills, different than a, you know what I mean? So people want to know, like, what does it feel like?
Yeah. So I think, again, it also depends on the products that you're using. Right. So there are 3 main classifications of kratom, and it's really about how it's processed, not so much that like these are different plants. There are different cultivars, like there's Mangda, there's Bali, and things like that. People, sort of classify them based on where they're grown, not so much to say like their alkaloid and flavonoid profile and things like that. Again, we have a lot of work to do with kratom. It's a little bit behind cannabis. So it's like, there's not as many strains and things like that, but white strains are energizing, green strains are energizing, red strains are more pain relieving and sedative. So again, you might feel a different effect. So if you have your green one, the green one. So if we're taking our morning green one by itself, right? Again, even within those green strains, there's different, subtle effects. So again, because they all have these different, entourage type of effects here. So for example, Green Indo is a strain that is it's almost like a green crack when we're talking about cannabis strains. So it's like super energizing. It's very similar to Adderall for me. Because I have a very upper personality already, I was like, whoa, I'm wired. This is not the strain for me. And so we actually don't sell that one anymore because it was like, it's very, it's intense, especially for new users. And that's, we found that our demographic was women that were sort of using kratom for their first time. And it was a little bit too much. So we went with more milder strains. Amengda is a really popular one because it is really helpful for pain relief. It's good for fatigue, but it's not like that wired feeling. And so, we didn't want to really go too heavy on the stimulant because that's not a fun feeling when you're just shaking. You're like, this is bad. Like, I feel like I'm doing drugs, it wasn't a good feeling. So I've tried a lot of different kratom brands out there and kratom vendors and experimented with CBD plus kratom plus all these different things.
Yeah, that's what I was going to ask.
Yeah.
So
what does this feel like, right? So the intended feeling is that you feel, again, it's going to be different whether you're a pain patient, whether you're a regular person. If you're a healthy person and you take one that's for energy, you are going to feel like you need to clean your house 13 times, right? But if you are baseline tired and in pain and you take something like that, you're going to be like, oh, I can make my bed. Yay. Yeah. So, it depends on where you start. And I think that's a really, really important thing. Remember, just like Adderall has a different effect on patients with ADHD than they do normal people that don't need Adderall. So
exactly. So here's
just
a question
to
too.
frame
So if
that.
someone has a stimulating, so for example, kind of like cannabis, you know how sometimes people get overstimulated, they're kind of feeling a little edgy. You know, we tell them to take, we have all these little things for them to do, you know, the CBD, the black pepper, the cold showers, the nature, the music, the food, the lemons, all that stuff. What about Kratom? If someone takes too much?
Yeah. So, I mean, with Kratom, it is short acting. So, I mean, worst case scenario, it should be over in 4 hours. Of course, if you're having a little bit of racing heart or like a panic attack or things like that, it's very similar. Yeah. So CBD can help calm you down. I would say vape is helpful. Again, just even breathing helps, but meditation, breathing, a little floor yoga or something like that, just get your mind off that. Also, if you find that you're more sensitive to those effects, you know, lower your dose next time. Choose a strain or a kind that's like less stimulating. So if you find no matter what you use, no matter what dose, green or white is not for you, you know, go with a lower dose of the red or something like that, where it doesn't make you sleepy, but it just provides a little bit of the relief that you need. Again, it's about finding what works for you. But yeah, that very first time, I mean, you can have a scary time if you're not used to it or you're not used to a new strain. So tell everyone, you know, if you're going to use a new product, you know, even if you are an experienced Kratom user, but you're trying a new strain or a new vendor for the first time, you know, try it, you know, not right before you go to work or something. You're like, whoa, what happened?
Yeah, that's what we usually do too with cannabis patients that are new, you know, on a Saturday afternoon, you don't have to go anywhere in the evening, you know, you have the space. So if you have a weird reaction that you're not expecting, at least you're home and you're in your space. And yeah, so that makes sense.
Yeah. And I want to tell people too that, you know, in most jurisdictions, Kratom is legal. Again, I would say make sure before you use it, you know, to check whether it's legal where you are. There are some states that have put it as a Schedule I drug in their state CSA. So that means it's like illegal. So there's a couple states on my book, Kratom in Medicine, lists what countries and states it's been illegalized in. And you just want to make sure, one, that you're not using it there, or like you're going to the hospital and you'll be like, oh my God, I'm having this like, you know, heart attack from Kratom or something. And you're like, oh no, I'm getting in trouble because I'm using something that's illegal. Most places are not supposed to ship it to you. Like my site has all these like, you know, techie things, just like on CBD sites, where if it's not legal, we're not shipping it to your city. Because we get fined in Nevada. That's how the law works. Like, but you know, some patients have no idea and they're like, oh, I used this and I told my doctor and then I got in trouble, or like CPS got involved. So like, make sure it's legal first before you use it. Again, it's very few states have you know, banned it, but it's like some surprising places. Like I told you, like Denver, Colorado banned it. I think they unbanned it because they just legalized like all drugs basically. They're like, why is cocaine legal but Kratom isn't? That's weird. So I think they went back and fixed it. But San Diego, it's funny. San Diego is a pharmaceutical like capital where they actually Kratom companies making tablets, but then if you possess it yourself, it's illegal. It's so weird. So like San Diego did, but like most of the United States is legal. So
one other question. So we were talking about that. What about drug testing?
Okay, so Kratom, one of the reasons why people use it is because they don't test for it. So it makes it a little bit easier. Like, I don't even think there's a secondary drug panel where they look for it. So that's why if somebody is, you know, needs pain relief and they're worried about having something that's a prescription that they weren't given, right, you know, by their doctor, and it pops up on their drug test, they get in trouble. Kratom isn't tested for. So very similar to like, it's like hard for like psilocybin to pop up. Like there's certain things that people use because it evades the drug test. And that's one. I know that lawmakers are like upset about it too, because they're like, oh, we don't want those people using the Kratom, you know, while they're at work and things like that. But it's pain management. So.
Yeah, it's pain. Well, that's it too. So, you know, we have to look at impairment. You know what I mean? Impairment is dose dependent when it comes to cannabis. And I'm assuming it's the same with Kratom.
You know, it's interesting. I think that when we do more research, and there's been a flurry of research studies recently, and myself, I'm trying to work with the local university to try to get some nice, like more like citizen science surveys and things like that about like using Kratom for work, for women's health issues, things like that. There's just not a lot there for anything besides like the harms of Kratom or use for substance abuse recovery. So for example, for driving, right? So if Kratom is helpful for focus, you know, at certain doses or with certain products, maybe it's better for driving, right? Of course, I'm sure if you're using it at a dose that might make you euphoric or sleepy, then it might not be good. So I think it's hard. It's very similar to cannabis, where you're like, well, I microdose and I'm a better driver, or I'm not in pain, so I'm a horrible driver. If I'm in level 10 pain, I'm gonna crash into a tree. I'm sorry. Like, don't. I have other people driving me around if I'm ever in that much pain, right? And that's the safe thing to do. But on the flip side, you can be, impaired by your medication, whether it's prescription or a supplement or food, so if you are ever, again, new to Kratom, do not drive the first day you do it, because you might be a bit surprised. Maybe it's a lot for you. You don't know, but again, adjust to your level. I would say that similar to CBD or cannabis, if you are a experienced consumer, you can use your medicine and drive a car or things like that, again, because they don't test for it. God forbid you ever got into DUI. It's not going to be like cannabis, where they're like, oh my God, you had the THC in your system. They're not scanning for Kratom. So.
Right. Yeah. So anyways, this has been amazing. I'm so excited. I cannot wait to order. because you know what I have? I'm going to get your tea, and then I have some honey from Super Botanicals that's got CBD in it. And
yes, they go together good.
Go together good, right? Super Botanicals, this nutrient-packed raw honey, targets formulated, and then the Kratom together. I cannot wait to explore, and then I'll have to report back.
You're going to be in a little blissville, let me tell you that. So we're going to talk like that runner's high, right? You got a little bit of endorphins, you got a little bit of your endocannabinoid system, buzzing. That's what I think, like, when you feel that runner's high, that's the similar effect of like when you take CBD and Kratom together, and you're like, I feel good, and it's nice to feel good, especially when you're a pain patient. So I would say, like, those are the treats. Like, don't do that every single time, but it's a nice little way to relax. So
yeah, absolutely. And that's what we're here to do, aren't we, Dr. Michele Ross? We're here to decrease stigma around what it means to feel good, because we all deserve to feel good. No more stigma.
Yes. And I wanted to just stress too, with Kratom, one of the things that you'll read online is that there's like horrible withdrawal symptoms and things like that. Again, when you use it responsibly, there is none, or it can be treated with CBD drops if you ever feel irritable or slightly in pain because you're not using your pain management anymore. So just wanted to clear that up. Is like, there are a lot of questions about that. I actually offer free Kratom consultations too. You can find the link on my website. I do a lot of education. So, again, it's like, great. I want you to learn, our goal is
Kratom consults. That's awesome.
Yes. Because it's really, it's like, you have to learn. Like, people have so many questions. They're like, is this safe with my medication? What do I do?
So right on your website, people can go and book. Okay.
Yes, it's on the menu bar on the bottom, a free Kratom consult, and they can book me on a little calendar and ask me some questions. And whether or not you buy my products, I don't care. What I care is that how to use it, and you're not like overdosing yourself the first time you use it and puking somewhere.
Oh my God. Thank you so much for that service. Seriously, that's really important.
That's what the book was all about. There wasn't really a good medical book. It was funny. People were writing books under like pseudonyms, and they were like not science-based.
Hold the book up again. Hold the book up. Hold it up.
Kratom Is Medicine. It's got a little picture of me on there.
Smile. Gotcha. All right, good. There we go. Kratom is medicine, you guys. Thank you all for joining us today. We have Dr. Michele Ross. I'm going to be putting a picture up of her and her website and her links. You guys can all book a consult, because really it is about living your best life and helping others do the same. Thank you all for joining us. We'll see you tomorrow morning.
Thank you.